when KHSU went offline, and it was Chico or whatever. And JPR actually has a lot of local information stuff. And they called me out of the blue and said, "Oh, hey, can we, kind of talk to you, and maybe we can put you on for one of our fundraising gigs?" And I'm like, "Sure." And so they, we just talked, and then they cut and edited, and I was like, "Oh, that's me." And then I had friends from Southern Oregon, who were like, "Well, Chere, I just heard you on the radio." So anyway, I have done a couple of things. That was fun.
Yeah, it's kind of an adjustment hearing yourself speak, right?
Yeah.
It takes some time to get used to.
Yeah, I sound like my aunt. I look like my mother. I sound like my aunt.
Best of both
Here
worlds
we are, getting older.
But no promotion in relation to your practice or anything like that?
No. So
is it just kind of hard to get the word out up here? Or?
Well, I did some advertising on KHUM, and one of the DJs would do all of the actual ad. I would tell them what I wanted, and we'd tweak it. And that, I always felt like, unless you're listening at just exactly the right moment, it's a lot of money that's not being heard. And then I used to advertise in the Journal, and I would do the special layouts in the Journal, and there was another one that was all about holistic healthcare that would come out once a year, and I did that. And so I've just been kind of at a loss, like, where can I get my best bang for the buck? And then I hired a new doctor, and he kind of had his hand and could do some website stuff and Facebook stuff. And so we started doing more on Facebook, which has been pretty good. But how do you get to people who aren't on Facebook? And then it's like, oh, we're advertising to Facebook because we've started a lot of new procedures in our office. And I realized that people in our office, our current patients, didn't know what we were doing. So we started, just simple stuff like a whiteboard in the office featuring one thing a month.
Almost like a little news bulletin.
Like a news bulletin. And then we would put the corresponding Facebook blog, print that out next to it. And that actually was really good because people were like, "Oh, I didn't know." So it's been difficult. I recently have been, I really want to get one of those big billboards on the 101 corridor. They're pricey. They're kind of pricey. So I'm kind of feeling that out, but I can see us doing something up there because, kind of a captive audience if you're going back and forth.
Yeah, hard to get away from that if you make that drive, right?
Right. So I'm really excited about this, talking to someone. I'm passionate about naturopathic medicine and what I have been able to put together up here. I have to say I'm kind of proud of it.
I'd be a little alarmed if you were going into this saying, I'm not really happy with what I've done. I feel like I wasted my time. That would be alarming.
Well, a lot of people do that. They're like, "Oh my God, I've been doing this for 10 years.
And I don't like it.
I don't think, I'm not getting anywhere." Naturopathic medicine, and I get reinforcement from our patients. People so many people I don't even know. They're like, "Oh, Dr. Edgar, oh my God, thank you so much for bringing this to this county," right? And naturopathic medicine. And it just makes me feel good. It really makes me feel good. We have, I think, over 3,000 patients right now.
Oh, wow.
Yeah. So there's 3 doctors and myself. I'm kind of backing away from seeing patients so much, just because running the practice is intense. It takes a lot of time. And I have 3 fabulous doctors. They're just amazing. We all do naturopathic medicine, primary care. Basically, we can treat whatever comes in through the door. And if we can't, if it's really out of our scope, then we refer. We refer to the local endocrinologist, cardiologist. Well, not endocrinologists because we don't have those. ENTs, cardiologists. We refer when we need to. But we can take patients so much further than the local conventional medicine, the medical doctors, right, who are so overworked. We were talking about that earlier. They don't have time to spend with patients. And, basically they'll run your basic labs and they'll come back and they're like, you're fine. There's nothing wrong with you. Here's an antidepressant. So frequently, here's an antidepressant. You're fine. And so we get the patients who come to us and they kind of plop the stack of files on our desk and say, I've seen every doctor in the county and everybody says I'm fine. What's wrong with me? Right. And that's kind of our wheelhouse. That's where we do such good work because we do more than your basic labs. We look at nutritional deficiency. Go figure, right? Oh, which is something I think conventional medicine forgets how important nutrition and vitamins are,
Well,
right?
not even forgets. They almost refuse to look at it. It's not even a factor that they
And it's
consider.
basic biochemistry. I was actually explaining this to my medical receptionist yesterday, and it's like our metabolism, our body runs on. It's like a really finely tuned Swiss clock that has all of these cogs interacting, right? And each of those cogs, when it makes contact in our body, it needs a vitamin or a mineral, and then that allows it to set off to another. So one chemical byproduct needs to be made into another one. It's just a chemistry process. But you need B12 or iron or magnesium for that process to continue. I mean, it's literally what makes the wheels of our body turn. And it fascinates me when I hear gastroenterologists say, oh, it's not about the food, or doctors say, don't take vitamins. It's a waste of money. It's like saying, don't eat. It's a waste. You don't need any of that fuel or anything.
I've heard doctors say, oh, you don't need vitamins because you're getting everything you need in your diet. From people whose diets I know what they eat, and they're definitely not getting it.
Excuse me. But yeah, even, I have a lot of patients who are like, oh, I eat really well. I don't need a vitamin. I'm like, do you eat like 10 or 12 servings of fruits and vegetables a day? Do you get good quality protein every day? And their eyes kind of go, well, I put lettuce and tomato on my sandwich, and then I have a salad, and it's usually like iceberg lettuce. Really not much nutritional value there. A little water, a little fiber. And you need more than that. I actually did a vitamin test of myself a few years ago, a nutritional test. And I eat really well. Like I literally eat 12 or 14 servings of fruits and vegetables a day, between a smoothie and the salads. I eat a lot. And then I take multivitamins and supplements as well, just to make sure I'm kind of topping things off, right? I'd rather have my body say, oh, you don't need so much of this and get rid of it than not have enough to get my wheels turning. And I was shocked when I got the response back from the test. I was literally deficient in several things. Deficient. And I thought, wow, that's crazy. And one of the things, so even though you can be eating really well, if your body isn't absorbing and doesn't have the right receptor, not the right receptor, say your receptors are a little funky from mom and dad, right? It's all genetics. So you get this receptor that maybe doesn't bind B12 really well, and it's going to keep showing up as a deficiency. So you kind of need to just smother your body in that vitamin or nutrient. I think of it as like if you have a car that has an oil leak, a slow oil leak, right? You just keep pouring oil in it so that your car keeps going. And when you don't put the oil in, it freezes up. Hence our bodies, kind of the same thing, right? So anyway, it was fascinating to me, just like, well, doctor, I guess you need to take more vitamins and do something else. But it allowed me to fine tune what I was taking as well, right? Having the results of this test. So yeah, we do really well. Kind of went off tangent there, but for patients who don't feel well, they just don't feel well. They don't know what's going on. So frequently it can be a chronic infection that, if a doctor runs a panel on it, they'll go, oh no, that just means you've had that before. Viruses, they're the worst. And it means, oh yeah, you've had it in the past and you just have antibodies to it. which is fine if you have low-level antibodies. But when you have really high-level antibodies, it means your body continues to fight this off, right? It's kind of the long COVID situation. And it's interesting because they've been doing research, lots of research with COVID, and wondering why people are getting this long COVID, right? And what they're finding is that there's pools of the COVID virus that hang out in the body, and it just keeps wearing the body down, right? Brain fog, lots of virus in the brain, fatigue, that kind of thing, and stress when your immune system gets a little overwhelmed by the stress and everything else, then you get more symptoms from that long COVID or other long chronic, viral infection. So it's kind of good to hear the research proving what we've been saying all these years. Like, no, you actually do have, chronic EBV, mononucleosis, which is the acute phase of it, or any of these other viruses, right? Or bacterial infections. And one of our doctors, Dr. Peachy, is brilliant with teasing out what kind of infection it is. And often it's several, right? Because your body can't get rid of them. And she treats them and just step by step gets people better. It's awesome. Such a great thing. And what else? Oh, and she's doing ozone therapy, which is this new therapy. It's very cool. And she does it through IV or injection, and it's good for pain and chronic infections. It just really helps support the body in fighting things. So that's kind of her thing.
For those patients that have,
sorry.
No worries.
Let's just
I've had my fair share of those moments.
Let's just turn that puppy off. I really hate. Certainly not an emergency. There we go.
For those people that are coming to you that have these almost systemic problems that they can't seem to get fixed by going to a local MD.
Yeah.
Is it dietary related? Is it that problem of vitamins, or is it more the viral aspect of they're not getting rid of the viral load in some way?
So it can be many things, right? And it's rarely one thing. Certainly fine-tuning nutrition, that's almost always where we start. What are you eating? Are you getting what you need? Are you getting out and moving your body? Just some basic stuff. But frequently these people who are so sick, like they're just so sick and nothing comes up on the regular panels. In this area, mold illness is a big thing. So it's just this constant exposure to mold. And genetically, some people are more prone to being able to, or getting sick from mold. And it devastates you. I mean, it just wipes your body out when you have this mold illness. Chronic Lyme infections, so huge in this area, so huge.
Lyme disease infections?
Lyme disease.
Oh, I didn't know that was up here.
It is. Everybody thinks, oh, East Coast. When I was in medical school, I'm like, I don't even have to listen to this lecture because I'm going to be on the West Coast. It's not an issue. It's endemic in this area. It's huge.
I did not know that.
Yeah, deer ticks. Bad. Really bad. It's not the big beige dog ticks that you see. They're very small. They're kind of a reddish brown. Even if they're the nymph ticks that are like the size of a poppy seed, those can infect you. So frequently people don't even know they've been bitten. They just kind of wipe their arms and off goes the tick and they don't see it. If you do get a tick, I recommend anybody who gets a tick bite, save the tick and you can get it tested. So you can look online, test tick tests, and send it in. So put it in a baggie, little damp cotton ball in there so it doesn't get all dried out. And they can test it for you to see, does it have Lyme disease? Is it carrying any of these other tick-borne diseases? Ticks are nasty little boogers. They carry a lot of disease. And yeah, it's all over the place. It goes up into Oregon. The Columbia Gorge actually has the Columbia River Gorge has a huge problem with it up there.
That wasn't even on my radar.
Yeah.
I'd always just associated that with the East Coast.
Yeah, no, it's bad. And if you get, the classic sign is you get a tick bite and then you get a bullseye rash, right? So it's red around the bite, and then there's a clearing, and then there's more red. It looks like a bullseye. That's classic. It can just get red looking, and especially if it starts small and keeps getting bigger, really bad. You need to see somebody. I kind of recommend you see somebody if you get any tick bite, and then you can be assessed. You can, people will say, yeah, I remember I got a tick bite when I was 12 years old, and God, I got so sick afterwards. I was so tired. And I always think, really, you remember when you had a tick bite and what you felt like afterwards? Because that in itself is kind of amazing. And then just the rest of their lives, like I have this joint pain that doesn't go away. I'm always so tired. Every month, a different joint hurts. That's classic, these roaming joint pains. Oh, this elbow hurts. Oh, that knee hurts. And then it resolves and then it comes back again. Classic Lyme disease. So many things I could talk about Lyme disease and Bartonella and Babesia, all of these tick-borne diseases.
Is there any way to combat any of those?
Oh, yeah. Oh, yeah.
Oh, you can?
Yeah. So it's interesting. When I first came to Humboldt County to practice, I started working with Dr. Beverly Copeland, and she was a functional medicine MD, so thought outside the box, right? She had this extra training that let her look at labs differently, very similar to what naturopaths do. And she was the first person to start treating Lyme disease in this area. One of her patients turned her on to it and said, look into this. And she was like, oh my gosh. And at that point, the only thing we really knew was antibiotics and more antibiotics, and 2 to 3 antibiotics at a time for years sometimes, which was so hard on the body, right? And coming out of naturopathic medical school, I'm like, oh my God, all my naturopathic mentors are turning over in their graves because I'm using all these antibiotics. But it worked. It got people feeling better. It was really hard then for them to recover because of all of these antibiotics, even though I was doing a lot of naturopathic support. Now it's evolved into looking more at immune systems and supporting from there. Like, why is your body not able to fight this off? So there's a lot of different things we're doing now, and not just throwing antibiotics at them, unless it's an acute bite, right? Like if you come in, you got bit, you're tired, your joints are hurting, like all of these things can start happening within a couple of days, then we'll start you on antibiotics because we want to stop that infection now and prevent that long-term chronic Lyme disease. Yeah.
And can people actually recover where they no longer have it? They can.
Yes.
I had not heard that.
Yes. So they actually can recover. Now, conventional medicine will tell you 2 or 3 days of doxycycline, an antibiotic, and you're good to go. That's it. And then they'll say, oh, we're sorry, you're still not feeling well. Well, that's post-Lyme syndrome, and that's just how you're going to have to live the rest of your life, right? The infectious disease specialist locally, now, I don't even know who it is now, but 5 years ago, 10 years ago, they would go, oh, no, there's no such thing as chronic Lyme disease. No. And they wouldn't even see the patient. It's so disheartening. It's really sad when you see doctors just kind of going, it's in your mind. You don't know what you're talking about, and it's these patients who are suffering.
And it's their life.
They
don't want to hear,
life.
oh, this is just how you're going to be living now.
Yeah. What do you mean? And don't tell me it's all in my head. And don't tell me there's nothing wrong with me, because they wouldn't keep coming back to you if they were okay. I'm sorry, there's not that many hypochondriacs in the world. There just aren't. So we do fabulous things. I love my practice. Love my practice.
Well, oh, no, continue.
So I was going to say, so I talked about Dr. Peachy, because she does a lot of these chronic infections. And really all of our doctors can address those things. But she's the one when we frequently inter-refer in our office. It's like, oh, okay, I think now you need to see Dr. Peachy. I've kind of taken you as far as I can. Dr. Deborah Ongersbach, she does these amazing regenerative injection therapies. So if you have chronic tendinitis or you have ligament injuries, torn cartilage, joint pain, those kind of things. She does these injection therapies, and one of them is PRP, platelet-rich plasma, and that actually helps your body regenerate tendon and cartilage. So if you have tears or even cartilage that's thinned out, she draws blood, spins it down, and is left with this plasma that has all the growth hormones in it and injects it back into the body. And it gets these growth hormones and these blood cells right to the areas that need attention, right? Because ligaments and cartilage and tendons don't have a good blood supply. So when you first injure them, your body will send a bunch of its healing properties to it, and then it kind of forgets about it. It's like, oh, okay, we've done our thing. And so these injection therapies, prolotherapy as well, kind of inflames these areas again. It sends up little red flags to your immune system to come back to this area and heal it. And it's amazing. I get a lot. I'm an avid cyclist, so I'm always like hurting myself or overworking my joints. And actually, I have a knee that I've been told is bone on bone, and she does injections in them, and it just helps. And it's regenerative, as opposed to a lot of people will get a cortisone injection, right? Oh, you have a shoulder injury, do a cortisone injection. That's fine. It's great to decrease that inflammation initially, but you can't do them long term because it degenerates the cartilage. It actually makes it worse over time. You can only do a certain number a year over your lifetime. Otherwise, you're going to destroy the cartilage that you do have. What she does is totally different. It's like, yeah, let's really go in there and regenerate it, and make it better and healthier. And it's so effective.
Is that kind of the same idea as using stem cells in a localized spot?
Some people do this therapy with stem cells. Dr. Angersbach does not do that. She doesn't find it necessary. And it increases the price immensely. And trying to find the stem cells, it's just kind of, she doesn't do that. She finds that it's just not necessary, and she gets really great results doing what she does. She's actually, she came to me from Montana, from Billings, Montana, when I was advertising for a doctor to come join my practice. She wrote and said, "I've always wanted to live in Arcata."
Who says that?
Oh my God, who even knows where Arcata is, like, other than wants to live here? It was crazy. And she was at the Yellowstone Naturopathic Clinic in Billings for years and years. And they have a residency program at that office. And so she used to teach residents, how to do PRP and prolotherapy. So she is just one of the best in the country, to do this. So I felt very privileged that she's part of our practice. And then our last doctor who's working with us is Dr. Holtzke, Gabriel Holtzke. And he's amazing. He loves kids. He loves to do pediatrics. So Dr. Ungersbach and Dr. Peachy and I love that, because we would see pediatric patients. Parents are always like, "Oh, can you see my child so we don't have to just give him antibiotics or whatever?" It's like, well, if he needs antibiotics, we'll probably give it to him. But yes, we're happy to see him. And we always had to say, we're not pediatricians. We don't know milestones. We don't know those basic kind of things that your pediatrician needs. So you need to have a pediatrician on board, and we'll see your child. But we can't be your child's pediatrician. Now we have Dr. Holtzke, and he's amazing with kids. So that's really great. And he does IV therapies. So we do nutritional IVs, which is also a really great addition to the office. So it's very exciting to see how the practice has grown and kind of progressed and branched out over the years.
How did you get started in naturopathic medicine?
Oh, that's so funny, because I flashed on this morning. I like to say it's my 8th career. Who can do one career in their life? I think that's crazy. I was in San Francisco, and I was a corporate banquet and catering manager. And it was such a fun job. I worked for Spectrum Foods, and they had MacArthur Park and Chow and just all of these really great, diverse restaurants in the city. And I had a little bit of a falling out with my manager. She kept taking my commission away to hire a new person. I'm like, why don't you take some of your commission away to hire this person? And so I ended up quitting, and it was the best thing that ever happened to me because it kind of released me from that area. And I thought, okay, what do you want to do? And I realized I wanted to do natural medicine. And I didn't even know about naturopathic medicine at the time. And I was going to start the program at San Francisco State. And then I just started reading more and I found out about naturopathic medicine. And at the time, it wasn't even licensed in California. So you couldn't be a naturopathic doctor in California at the time. That was in the 90s. And so I went back to school, and it takes a while when you're an older student to actually get through school. And went to San Francisco City College, then came up here to Humboldt and got my undergrad from Humboldt. So I'm an HSU alumna. And then I left. I was actually going to go to Portland for medical school, for the naturopathic medical school. It was National College of Naturopathic Medicine at the time. Now it's National University of something. I don't know. They keep changing names on me. And so I was planning on going there. And then somebody said, oh, you should check out the school in Arizona. And I thought, oh, Arizona. Okay. And they kind of won me over. So I ended up going to Phoenix, to actually Tempe, for medical school. The hardest thing of medical school was living in Arizona. It was horrific. It was horrific. So hot, so hot. Every time I'd look outside, it was like, oh, what a gorgeous day. Let's go outside. And you'd open the door and it was like, ooh, blast of 120 degrees. Let's go back, hide in the cave, close all the shades. It was horrific. So anyway, graduated from there, came back to Humboldt because I knew I wanted to be and live in this area. And that's kind of where I started with naturopathic medicine. And before I actually moved back, before I graduated, I started reaching out to doctors in the area so I could say, hey, what's it like having your practice? What do I need to do? And the first doctor I called was Dr. Beverly Copeland. And her receptionist said, oh, we're looking for a natural doctor right now. And I'm like, well, here I am, right? I naturopathic medical school. And she'd been looking for a doctor or a PA or a nurse practitioner, I think for 3 years by the time I went in. And she just couldn't find who she wanted. And I went in for a little interview and a meet and greet, and she showed me the office, and she showed me the office I would have and the exam room I would have. And I always say, poor Beverly, she never stood a chance after that point because I'm really good at manifesting, right? So I went home and started visualizing, walking into the office and saying good morning and going to my office. And there I am today. She retired 7 years ago and left me the practice, and I promptly made it into a naturopathic medical practice and hired Dr. Peachy and then Dr. Angersbach and eventually Dr. Holtzke, and that's where we are now.
The rest is history.
We're kind of packed to the gills right now. Don't know how I could make any better use out of the space we have, but we're also maybe I won't say this yet. Never mind. We just started something new, but I'm not quite ready to let the public know about it yet. So
still working out the kinks.
Well, yeah. I can talk to you about it off, but yeah, I don't want it to say anything now because we'll get overwhelmed, and I'm going to let the individual practices know when I'm ready to go there.
So back when you started, you couldn't even be a practitioner of naturopathic medicine.
No.
Is that out of a stigma again? Because it seems like it was such a separate world from like an MD.
It is a separate world. It's interesting, and it's still, even though we're licensed in California, and I think we got our license in 2000. It was actually just before I went to medical school, so it was around 2003, 4, 5, something like that. I should know, but where California actually started licensing naturopathic medicines, and we're licensed in over 30, 35 states right now. And every state has a different scope of practice for these doctors. It's really hard. It's really confusing. The fullest scopes of practice are in the states of Washington, Oregon, and Arizona, where all the schools are. And they basically can prescribe freely. They can do the minor surgery that they were taught in medical school. They can use their acupuncture and actually call it acupuncture where they work. And in California, we have kind of a limited scope for writing prescriptions. To write controlled substance, we have to have an oversight MD to have on board, which is kind of weird. Like our oversight MD is in Connecticut. She lived here and then she moved, and it's like she looks at our controlled substance prescriptions and our other prescriptions, and says something to us if we're like, maybe you should try this part or do this, and we're like, oh, okay. But it's kind of weird, right? Um, Otherwise, we can't do minor surgery, so we can't do suturing, we can't do a punch biopsy, all of these really kind of basic things that we were totally taught in medical school and know how to do, but we can't do it with our scope of practice here. So we refer a lot to our local dermatologists, again, or surgeons, whatever, for whatever you need. It doesn't really We're considered primary care doctors in California, and yet there's still a lot of things that haven't changed. So some of the basic, like state disability papers or DMV handicap placards or these really kind of basic things, because they have not changed the paperwork that includes naturopathic doctors in the signature line, we can't fill those out. It's very interesting. For a long time, I would just, sign my name, put my state license, because hello, California, you have licensed me to be the primary care doctor. And for a long time, they let that go. And now there's somebody in the state who's like, nope, you're not on our little list. You can't do it. And it's like, there's podiatrists and chiropractors and midwives and, acupuncturists on this list who are not licensed primary care doctors. They're licensed, but we can't sign it. It's so hard for our patients, right? Like I've been seeing some of my patients for 15 years. 15 years? Is that right? 13, 14 years, I guess. And, if something happens where they need state disability and I'm the one who's been seeing them and knows the most about them, I can't fill out that piece of paper. They have to go and find another doctor. I generally write up the history for that doctor so they know what's going on, and then that doctor can sign it. It's so unfair. So we have a state association, and they're continually working on expanding our scope, getting it in line with what we've been trained to do. So
Is that out of a lack of specific training that would have been applied had you gone down the MD route, or they just want people to go down the traditional medicine way?
So, I think it's a feeling of being threatened. So the AMA is the CMA, the California Medical Association, and actually the acupuncturists are really kind of fearful of having us be licensed. So lobbyists, the politics, so
The money.
the money. So the CMA, California Medical Association has a lot of money and they throw it at blocking our things. They're like, who are these people? And, why are they trying to get their doctor? And why do they want to do this and that? And it's like, we actually have more education than you do. We have equal in a lot. And like nutrition, well, they get an hour of nutrition and it's, a major focus of what we do. So it's a feeling of being threatened, I think, more than anything else. And slowly they're kind of warming up to us and, but it's hard and it's all about lobbyists and who has the most money to throw at it. And so, we're a small association. I don't know, I think there's just over 1,000, 1,500 naturopaths now in California. I'm like number 390. So I've been around for a while, I guess. It was kind of interesting. But yeah, it's politics more than anything, more than anything. And I don't know why they don't look at like Oregon and Washington, and why they don't just follow suit. And we need more doctors. Like if I couldn't do what I was doing up here in Humboldt County, 3,000 patients would be left without a doctor. And these are patients who you can't find a primary care. And I love Open Doors so much. They do so much for our county. But they have this huge waiting list, and it's like, well, get on the waiting list, get on the waiting list, especially for our Medicare patients. So here's another really weird thing. Because the federal government doesn't quite acknowledge us as naturopathic doctors anywhere in any of the states, even though we're on their official, their official vocational book. They haven't recognized this, so we can't take Medicare. We can't we can see Medicare patients, but they have to pay us cash. I can write prescriptions for Medicare patients. Like I can write their thyroid prescription, no problem. But can I order a lab to double check to make sure that thyroid level is now controlled where it's supposed to be? No. Write their prescriptions. Thank you, pharmaceutical companies. They've pushed that through. But I can't order a lab and have it covered by Medicare. My patients have to pay cash for that. Or I always recommend that they have a Medicare provider, like somebody at Open Door. And we work really well with the practitioners at Open Door. And so frequently I can write them a note and say, oh, I'm seeing our mutual patient. Could you order these labs? Blah, blah, blah. And most of them are just great with that, and we'll run their labs for them. So Open Door has actually started referring patients to us in the last couple of years. They're like, we just don't have the time to figure this out. You should go see the doctors over at North Coast Naturopathic. And that makes me feel good, right? When I see more and more of the local people acknowledging us and seeing what we can do for their patients. Because we work in collaboration. We're not trying to take patients away. We're trying to get the patients feeling better. That's our goal. We refer to people if we think, nope, you need to see somebody else. It's not about, keeping you for myself. It's about getting them better.
Well, I think there's kind of a stigma that surrounds naturopathic medicine, at least from an outside perspective. You hear that, and then you start thinking holistic, and then you go down this rabbit hole of it's not real medicine. Like you need to go to a real doctor and get prescribed something, and then that's going to fix you. And so it makes sense that there would be that conflict of, hey, we're here, we're helping people.
And it's I always say, make sure they're licensed in the state of California. I've actually had to report a couple of people who called themselves doctors of naturopathic medicine. And when you look, they had like online degrees, and they're like, oh, we're doctorates. I got my doctorate online here, and I got my doctorate online there. And I just talked to my patients like, do you really want to see a doctor who never put their hands on anybody, who's never had any like anatomy labs or, in-person clinic training to be your doctor? You need to kind of do your research. There are a lot of great consultants, nutritional consultants, whatever, and they'll say they're doing natural medicine or are a naturopathic consultant. As long as you don't call yourself a doctor, naturopathic doctor, you can kind of get away with it. But as soon as you start calling yourself a doctor of naturopathic medicine or an ND, that's where you can get in trouble. And I've reported people because it's like, I'm sorry, you get my $250,000 in student debt, and then we can talk, right?
Well, and they're bringing down the practice as a whole,
Well,
right?
they
If
are.
they're just kind of a fraud.
Yeah, most definitely a fraud. And, it kind of gets my back up and kind of irritated. But, in the end, I need to just put my focus where my patients are. And, I keep my eye out there and kind of check to see and talk with my patients about who they might be seeing. And some of them are great, okay, great. If this nutritionist or dietitian is really helping you, great. And then when you want labs done, come back to me. I don't know. It's a collaboration. But it's what you said is really true. It's hard to keep the field clear enough, because it's really hard to call yourself a medical doctor, an MD, and just get away with it if you don't have the licensing. And certainly there are a few people who don't have their license and they're practicing. Very few, but you hear about that every so often. Oh, this person was calling themselves a doctor and they weren't licensed. The same thing happens with naturopathic medicine. And I think it's just important for people to do their homework, to really kind of look. And, people love to put that line of letters after their name. That's always kind of suspicious, right? It's like, what? Why do you have to have all these letters? Oh, you're certified something and it's certified this. And, if you're truly a doctor, you have Doctor of Naturopathic Medicine and you have the school that you attend. So that's the other thing that almost always distinguishes a doctor of naturopathic medicine who's licensed is we will always put the school that we attended, and it's an accredited medical school. We have to pass boards to get it. We have to pass licensure tests to get our license, and then we have to renew it. We have to do a certain amount of continuing education every couple of years to keep our licenses up to date, like any professional, right? So that's the kind of thing you need to look for.
Is there any substantial difference between an ND and an MD in terms of the education or what you could practice?
Yeah. So our education is very equivalent. We tend to have more nutritional education. I think MDs get like an hour in school. We get a lot of nutritional because we believe, your nutrition has to be up there. Surgery, we do minor surgeries. We are not surgeons, right? We are not doing cardiovascular surgery, thoracic surgery, amputate. We are not doing that kind of thing. You don't want us around. We can get you stable if something's going on, but we're not emergency medicine doctors. We're not surgeons. We love conventional medicine because it's kind of miraculous what they can do now with surgery. Other things, so we don't tend to specialize, right? We have a couple of specializations that you can get your fellow in. Like we have oncologists who have done extra training and have passed extra board exams to become a fellow in oncology or endocrinology. And I think we have one, I don't know, there's a couple that you can actually get pretty specialized in. There are a couple of naturopathic doctors who actually work in big conventional hospitals. There's one who works at the OHSU up in the hospital up in Portland. One doctor was working, kind of specializing in cardiology and worked with a lot of cardiologists at a major hospital in Washington, the state of Washington. So they kind of make their own pathways and get into these places, but they're not doing cardiology and surgery in these hospitals, right? They're kind of putting their own expertise and what we do in with the MDs. So there is a big difference.
My
actually.
understanding of that difference is that if you want preventative care, it would be naturopathic medicine and general wellness. And then if you need like a surgery or you have cancer, then you would maybe go to the MD also
Yeah,
for that.
for definitely those things. We are definitely about preventative medicine. Definitely, like fix the problem before it becomes a problem. And frequently MDs are like, watch and wait. And when it's like, oh, when your labs are actually over that reference, when they're in the warning sign, then we'll treat it. And it's like, why do that? Why not treat it before? Because you can watch the labs changing, right? But we also treat things, so we treat acute illnesses, we treat pneumonia, we treat infections, we treat ear infections, bladder infections. I mean, these acute things as well that come up. Like I said, we really can treat most things that come through the door. And when they're emergent, when, we can tell, no, this is neurological, this is going into, cardiac arrest, whatever like that, we are sending them off, right? We are not seeing these patients, and then they come back to us. Even with oncology cancer patients, there are a few doctors who treat cancer. We don't treat cancer in our office. We do a lot of supportive therapies. And we recommend to our patients that they see a specialist, either conventional oncologist or a naturopathic oncologist, because some people really don't want to go the way. And yet there's times when you need radiation or chemotherapy. I mean, it can save your life. And we would be more than happy to support them to help the side effects of some of these really crazy treatments, right? There's things that you can do to support the body to make them a little bit less horrific, but they'll save your life, you know? And then there's times it's like, well, that that could be an option, but it's not a cure. So also being really clear with patients, because a lot of oncologists will just say, you got to do this, you got to do that. And then they turn around and say, I would never do this treatment, because it's kind of like, you're past that stage. But so that sounds horrible, but it's kind of what am I trying to say? So I guess hearing the truth truly is most important, having supportive care when that's necessary. Yeah. So cancer's a tough one. But we're always screening for it. We always do the preventative testing for that and try to keep our patients up. We can do like women's annual exams, their PAP exam. We can do male exams. Physical exams are part of our thing. We do those very well. It's part of our preventative care medicine for sure.
If somebody comes in with an acute illness, is there a difference in your approach than from that perspective of like a general family doctor?
Yeah. So it can be different. It can be the same. It kind of depends where they are in that acute infection. A lot of times we recommend, so we do a lot of herbal treatment. Like one of my favorite places in my office is our medicinary that has thousands of botanical tinctures and homeopathy. And they're incredibly strong, good medicine. And so frequently we will treat bladder infections and upper respiratory infections, colds, flus, whatever, with botanical medicine, with some nutritional supplements. We have some really cool hydrotherapy treatments that we could use as well. And then we monitor really closely. We have that patient check in with us. And if they're not getting better, if it's turning into pneumonia, then yeah, we'll probably start you on antibiotics, right? We're not going to say, oh, no, we can do it with herbs. It's like, no, we know the point when we need to go, okay, this needs antibiotics. And sometimes patients come into us and they're like, I know I could take the herbs, but I kind of just need to get this over and done with. And the antibiotics are going to be covered by my insurance, right? And the herbs could be kind of pricey. So we go like, great. If that's what you want, we'll start you on the antibiotics. We'll give you some probiotics so that your gut flora isn't totally disseminated, wiped out. And because we want to keep our gut nice and happy with all those good beneficial bacteria. And so we'll start them on both of those things, right? So it really depends. We love our natural medicine. We know the limitations of it. Blood pressure stuff, it's like, yeah, I have really great herbal medicine for blood pressure, and it can be pricey. Getting the herbs can be a couple $100 a month. Why do that if you can pay $5 for your copay and get losartan, right? And it does the same thing. I have some patients who prefer the herbs and they'd much rather pay the money than use the losartan. It's their choice, right? So we give them more options.
Are the herbs in most cases equally as effective?
Yes, they can even be more effective,
Is
right?
that hard getting that through to your patient? I mean, do patients come in and just think, "Oh, the only option is meds," and then you
N
bring up herbs?
Not really, not the patients that come to us. Sometimes we talk to them about it, and we're not ever gonna strong arm somebody into it, but with the herbs, so many of the medications we have come from herbs, right? Like aspirin. It's willow bark. It's a tree, and what they found was that, oh, the salicylic acid that comes out of the willow bark, we can just, like, isolate that and pop it in a pill, and then they're all gonna get better, and it works really well, but if you take the whole herb, you're gonna get so much more benefit, right? Because Mother Nature kinda knows. We're gonna put some buffering things in here, so maybe it's not so hard on your stomach taking it all the time, and it helps support the rest of the immune system. There's frequently other actions these herbs have, and a lot of these drugs start with plants. I mean, just across the board, digitalis, right? Well, that's that beautiful little flower that you see in your garden. It's strong cardiac medicine that they then isolated and put into a pill. So that happens a lot. Patients who come to see us frequently are seeing us because they want an alternative, right? They like hearing all of the alternatives they have. So yes, we could do the medications, or we could do this. So we try to lay out their options, and we give them the pros and cons of both. And then they have the choice. They get this great choice. Years and years of antibiotics and being thrown an antibiotic every time you have a cold, which is a virus, which antibiotics antibacterial does not help a virus at all. So we help educate our patients and let them see the difference between antibiotics and antivirals, and where things can be helpful. And, well, why are you getting a cold every 3 months? What's going on that you're getting this? Or why are you having a sinus infection chronically? I don't want to just keep throwing antibiotics at you, even though it could be very helpful and get rid of it. We then step back and go, okay, let's look at this underlying issue. And that's really where we always go. Where is this underlying cause of infection, right? What's going on there, and how can we optimize your body so your immune system can fight these viruses? You put 3 people in a room and one person gets horribly sick from a cold and the other 2 people are fine. What's going on there, right? It's how your immune system is reacting to things and how you're dealing with the stress in your life, and are you getting enough exercise to help alleviate that stress? We kinda talk to them about all this. Our appointments are really long, as you as you can
Which
imagine.
isn't a bad thing.
It's not a bad thing, right? Because I always think, how can a doctor figure anything out in 5 minutes? You go in and they're like, "You can give us one problem and you've got 10 minutes, go." And you're like, but my head and my stomach hurts." It's like, "I only have time for one problem. What are we gonna talk about today?" And usually these things are, like, together because there's a bigger issue, right? It's not just the stomach, it's not just the head. So our new patient appointments are an hour and a half long, sometimes a little bit longer.
I don't think I've ever talked to my primary care physician for even close to that
Yeah,
amount of time.
yeah, well, never, never. An hour and a half would be the equivalent of seeing, I don't know, something like 20 patients or something,
I don't know if I've
some
spent that much time with any doctor, actually, now that I'm thinking about it.
maybe a shrink, well, that's 50 minutes, but we do a lot. Our intake is a lot about history. What illnesses have you had before? What's your antibiotic history? Do you have a chronic yeast infection going on because you've been on antibiotics 20 times since you were 2 years old? So all of that is super important, and oops.
We're good, it was empty, thank God.
Uh, and, so, oh, what was I gonna say? So, just figuring out what's going on so frequently is like, we need to listen to the patient's story, because we'll get these little clues along the way. And then for the patient to actually be heard, I've had so many patients just cry in my office and say, I've never had a doctor just listen to me. and hear my story. And sometimes that's all we do. I'll have patients come in and, it's for this, but I end up sitting there and listening for 40 minutes, just hearing what's going on in their life right now. 'Cause, it's big what we carry around with us. And if you don't have somebody who can hear that and not be judgmental and not necessarily try to fix it. I mean, I'm not a psychotherapist. I'm not trying to fix something, but just hearing it for them is incredibly empowering for them. And sometimes I could tell them a few things, maybe help them sort things out. That's great too. Um, but yeah, and even our follow-up appointments, rarely are they shorter than 45 or 60 minutes because we have treatment plans. We send patients out. They can be kind of overwhelming sometimes with things that we want them to work on, right? From nutrition to exercise to starting some different supplements, right? And then maybe labs. We do a lot of specialty labs as well, stool testing, saliva testing, um, just blood work. So a lot of different tests that get deeper than your basic lab tests, right? We look in the stool. How is your gut bacteria? Do you have an infection going on that's showing up there? We look at saliva for adrenal function, right? Why are you chronically fatigued? Oh, look at your adrenals are like flatline. They're not responding the way they're supposed to. Kind of like mine in medical school. They're better now. So, yeah, we spend it. It takes a lot of time to do what we do, but we get really good results, and that's why patients keep coming back to us. And our biggest referral is from friends and family of patients that we already see. It's kind of amazing. I love it. I love my practice.
Where did that shift come from? Where we moved away from herbal treatments in some cases to just prescribing pills? Because for most of human history,
Yeah.
that's what we did. And then there's this weird paradigm shift where now to think about taking plant medicine, you're some fringe
Yeah.
woo-woo
Yeah.
skeptic of modern medicine.
It was a paradigm shift. You absolutely have that correct. Most of the world uses the kind of medicine we do, right? Especially the more indigenous peoples who haven't been overwhelmed by cultural society. But it actually happened around the turn of the 20th century, early 1900s. And there was actually a lot of naturopaths at the time and a lot of homeopathic doctors. And it's when the AMA came into being, right? The American Medical Association. And they started shutting down, like Hahnemann Hospital. I think it's in Pennsylvania. Um, so Hahnemann was a homeopathic doctor. He's the one who developed homeopathic medicine, which is taking an element, a plant essence, and diluting it down infinitesimally. So if you're looking at it at a chemical point of view, there are no moles, no of the smallest little measurement left in that diluted substance of the original substance. So like you could take mercury, you add a little bit of mercury, put it in water, you shake it and you keep diluting it and diluting it, diluting it. And if you look at that in what are they called, a chromatography, where they can see how many moles of that mercury is left in there, there's really nothing left in it. But that the water, the substance has the vibration of the original. And so with homeopathy, you match the person's symptoms. A real easy instance is coffea, homeopathic coffee, right? So if you drink too much coffee, you feel anxious and a little jittery and you can't sleep and your mind is racing, right? It's a great sleep remedy. So I'm asking my patients, so are you just not sleeping at night? Is your mind racing? Do you lay down and start getting anxious? And they're like, yeah, yeah, yeah. And so I'll give them homeopathic coffea, which is this very, very, very dilute equivalent of coffee. And they put these little pellets under their tongue and they go to sleep, right? So it's like treating like homeopathic. And so Hahnemann developed this source of medicine. They had a homeopathic hospital in Pennsylvania, Hahnemann Hospital. And then at the turn of the century, they basically outlawed homeopathy, right? Even though it saved millions and millions of people in the flu pandemic of, what was it, 1912, 1911, really horrific flu pandemic. Yep, it was homeopathy that saved more people than anything else. It's kind of crazy. And then, medical doctors, they were like, oh, these natural doctors, they're quacks. What are they doing? We need to keep bleeding people and using leeches. And, like, really, it was the medical doctors who were kind of like, really? Let's just bleed more people, or, doing kind of old archaic things or new crazy things. So yeah, that was the paradigm shift, and so naturopaths got outlawed. They became start running from the law basically and kind of practicing underneath, kind of in the background. And then now we're just slowly coming back up. It's a hard thing to fight those paradigm shifts.
So was it all just the money aspect of if we can condense it down into this pill form, we can sell
Well,
more and people can't grow their own medicine?
certainly. I mean, pharmaceutical companies are all about that. They're all about that. They're trying to actually outlaw vitamins right now. The
I
FDA
had
is,
not heard that.
yep, they're working really hard at doing that. There's a lot of things that the FDA is doing to try to take away natural medicine, saying it's dangerous. You can't do that. They'll take it off the market. We've had several of our own supplement things taken off the market, and then it shows up as a pharmaceutical thing, right? Where they tweak it. You can't copyright anything natural, right? But they can take that chemical compound, that molecule, and tweak it a little bit, add a little benign something to it, and then they can copyright it because it's no longer the natural element. Pharmaceutical companies love to do that. Fish oil, we still can use fish oil, but the pharmaceutical companies now have pharmaceutical grade fish oil, right? Because they kind of tweaked it a little bit and they can get more money from it. It's kind of insane. Why it all happened around the turn of the century, I'm not really sure. Is it more of a money grab? Was it, financial? I'm sure money is always there.
It's usually at the bottom of
Follow
the
the money
chain.
trail, right? So that was probably part of it. I wish I could go back in my memory because we actually had a lot of this in medical school, the history and philosophy of naturopathic medicine. And I can't remember exactly those things that led up to it, but I know there was a lot of changes in the law being outlawed, and I just find it hysterical. Like Hahnemann Hospital is still called Hahnemann Hospital, even though homeopathy is not used there at all. So.
Have you noticed a change recently, post COVID, in this world where people are more obese than ever, people are sicker than ever? Has there been a turn back to you guys where modern
Um,
medicine has, I mean, it's just you're just taking pills in
yeah,
some sense.
certainly I don't know if it's happened since COVID, um, since that's so recent, actually, still. Um, I think there's a lot of people who really want to make changes in their life, and they're really tired of seeing a doctor who doesn't know, who doesn't who wants to put them on a antidepressant or an anti-anxiety medication. And they really want to figure out what's going on, and they want to do something other than just drugs. Um, Not all of our patients, we have a spectrum of patients, and some are like anything they can do not to take a drug. And others are like, I'm okay with that, but I want to optimize where I am. And if I can get off these drugs, yay, because I want to do that. Um, and there's that whole spectrum in between. So, and you have to be willing to change if you're coming in to see us. it's a lot of hard work, right? I mean, there's always going to be that population who says, no, give me the pill.
It's
I
easier.
don't want to diet. I want to sit on my couch and drink beer and watch TV all day. Yay, good for you. But then there's a lot of people who say, no, I really do want to change. And I know it's really hard. And it can take years, to really. I can talk to my patients and say almost the same thing. Some of my patients, I love my patients. And, I'll be saying, oh, you should do this, you should do this. And the next time they come back, it's like, well, you really should do this. And then one day they'll come in, they'll go, oh, Dr. Edgar, I just did this. And sometimes it's because, oh, I started seeing this nutritionist and she said I should stop eating gluten. And oh my God, I feel great. And I smile. And I laugh to myself because I think I've been telling you that for 5 years. But yay, sometimes it just takes that point in time, maybe a different voice. When you're ready to hear it and you're ready to make that change, yay, right? I will just sit there and work with you wherever you are and get you through that. And then they make these amazing changes. And I have a lot of patients who are just like, a few patients who are like, literally, you saved my life. And literally, I did because we were able to figure out the chronic infection they had. And I'm thinking of one patient in particular, and he was so sick. And his parents are like, why are you seeing this naturopath? You need to see a real doctor. You need to see it. And this was an adult man. And he said, okay. And I said, no, you should go see this doctor. Get another evaluation, do what you need to do. And this doctor ran all of these other tests. A few of them are like, oh, that was a good idea. I hadn't thought about that test. That was a great idea. And he did all these tests. He goes, yeah, no, you have chronic fatigue. You'll be fine. You have chronic fatigue. And the guy was like dying before our eyes. I mean, it was so hard to see how sick he was. He could barely breathe. And we just kept working and very slowly at working over this infection. And today he's fine. I mean, he's still kind of struggling with a little bit of energy and things, but doing so well. And, he's saved my life. And, so we do amazing things for our patients and we work with them where they are at the tempo they need to be moved along, I guess.
Well, there's that famous quote where you can lead a horse to water, but you can't make him drink, right? That's just
right. You
the
can keep
struggle of
showing them
life.
the water. It's like, oh, there's some good water over here.
It'd help you if you drink some.
It really help you. Oh, and water is a huge thing, right? Drink a little bit more
How
water.
many people don't drink enough water?
Everybody. I struggle with it myself, and I like to think I drink a lot of water, and some days I drink more, and other days I don't drink enough. And I only drink water. I'm not a soda drinker. Oh, well, I drink coffee. I love my morning coffee. And no, we don't take coffee away from everybody. It's like, well, you might want to cut back on your coffee. Maybe you don't want to be drinking coffee at 5 o'clock at night when you're trying to go to bed. And I actually heard Huberman. What is his name? Dan Huberman? No.
The
Huberman Lab.
Yeah, great podcast.
He's brilliant, right? I have my own little things about him, but he was talking.
Andrew Huberman. Sorry to interrupt you.
Yeah. Thank you. He was saying recently, or on one of his podcasts, that you actually do get water benefit from drinking coffee. It's the chemical molecule of caffeine itself that's doing other things, but you actually are getting a benefit of drinking. I was like, yeah, so happy to hear that. But
I've actually implemented some of his caffeine protocols around that. Like, I don't take caffeine within the first 90 minutes of waking up. I don't take it within 12 hours of going to bed. And there's a tangible
90 minutes
difference.
of waking up. Interesting, because I thought he was all about caffeine and exercise and fasting exercise and drinking caffeine. I haven't listened to all of his. He is brilliant. He's a brilliant man. I have to say I'm going to go off on a little spiel here because it's my newest passion, is when he starts talking and about exercise, right? And he's had some amazing, what was this guy he had on for this series?
Peter Attia.
Not a Tia. He's an exercise physiologist. He has this amazing lab. I think at Stanford. And he doesn't see sick people. He only sees athletes because he's all about optimizing. And he like had an 8 series thing with him or something. But everything was geared towards men. So here I am, postmenopausal woman, right? And it wasn't until 2016, this day and age, that there was ever any exercise research done on females, right? Everything else prior to 2016 was done on males, by males, for everyone, right? It's sort of like, yeah, we tested birth control pills on male rats. Well, hello, what is that? And so Stacy Sims, she's a PhD, and she was working on her doctorate at Stanford. And she was doing all of these exercise research things with females. And these dudes would walk by and they're like, what are you doing? We have this information already. Those women, those hormones, it's just going to fuck up your life, right? What are you doing? It's so much work. She goes, exactly. We are not little men. We have hormones. We work differently. We need new research. And she's been putting out phenomenal information for not just menopausal, postmenopausal, perimenopausal women, but all stages, because women have cycles, right, with these hormones. And some days are better to exercise and really go all out. And other days are better to like hang back and do some recovery depending on where you are in these exercise in your cycles. And she goes on to talk about, like Huberman loves the fasting exercise, right? And he's like, yeah, it's a great thing. And I'm yelling at the radio going, only for men, only for men. Our physiology is different. And we do not do well when we're doing fasting exercise. We have these bodies that think we are being starved to death, and we start, like clumping down and conserving energy and such, right? Because we're these baby makers and baby carriers. So we're kind of built to do different things. So we actually need energy, food, before we start doing these exercises. And, if you're postmenopausal, you actually need to do, a certain amount of protein and carbohydrates before you go into a hard workout. And then within a half an hour, you need to be eating a lot of protein, like 20 to 40 grams of protein right out, especially if you're doing strength exercising, right? You need to get that protein back into your body, some carbohydrates. Again, Huberman's like, as long as you get some in during the day, you're good. Yelling at the radio, like, no, you need to qualify this, dude. Men, women, we're different. So it's one of my new passions right now. And I actually just submitted a talk to one of the conferences I go to. So I hope I can help spread that information, because overall people need more protein. Women especially need more protein.
Need more protein and need more exercise.
Need more exercise and different kinds of exercise. So as we go into menopause and we lose estrogen, which is this anabolic muscle building, I hope I got that one right, the muscle building, tissue building hormone, right? And you lose it and you start losing muscle. And all these women are like, I was so strong, I had these muscles, and now suddenly I have nothing. And it's because you don't have the estrogen. And so you need to LHS, lift heavy stuff. And you need to really lift heavy weights, like these little weights that are good for definition. That's all fine and good, but you need the power. You need the strength. You need to build muscle. And so for postmenopausal women, it's super important. Also, I do a lot of cycling, and when I was training for a ride last year, it was a 10-day ride up in Canada, and I was carrying all my own gear. So it was like 50 pounds on my bike, lots of elevation gain, over 23,000 feet of elevation, right? Lots. And my friend and I were training, and we're like, oh my God, we just got to get out there every day with our bikes loaded and ride every hill we have and do hill repeats. Otherwise, we're not going to make it. And we were exhausted. And I met up with this cycling coach who follows Stacy Sims. And she's like, yeah, no, honey, that is not how you train for a ride, you know? And I said, oh, well, how do you do that? What can I do in the next 10 days before my ride? She goes like, yeah, no, that horse has left the barn. Not much you can do now. And I started working with her after that. And it's about, so you need to do high intensity interval training. Super important. These really long endurance rides, you need to do them because you need the hours under your butt and your butt in the saddle and kind of building those calluses. And you need to have that, but not every day, right? Again, men do really well with these long endurance type rides as a training mechanism. For women, not so much, right? Our training, we need to do high intensity interval training. We need to do sprint training, up and down stairs or run for a block, or I don't run at all, but cycle really hard. I do everything on a bike. And, do all out for 20 seconds, 10 seconds recovery, 20 seconds all out. Do that 8 times and then recover. And then do it again 8 times and then recover. So you're only doing these 4-minute exercise bursts, but super, super important for women. We need to do different things than what men do, and it's finally being researched and it's out there. She has 2 books, Roar, ROAR, and Next Level. And I highly recommend those books, and finding her on podcasts. And Stacy Sims. I'm going to say it again because she's my hero right now. I've
Yeah.
gotten strong. I've gotten fast.
Well, it's
amazing.
important, and you want to try to keep that up as you get older, especially. Your body just starts to deteriorate if you don't.
Yeah. I actually just started doing it when I got older. I'm in better shape now than I've ever been in my life. I was never an athlete before, and now over Memorial Day weekend, I rode a Century Mile ride on my bike, and then the next day, I rode my brand new gravel bike for 75 miles.
Wow!
It was
next
awesome.
day.
Yeah, next day, and with the help of my coach, I fueled right. So I was exhausted after the 100 miles. I have to say. Did what I needed to do for recovery that day and iced my legs and ate correctly, fueled right during the ride. Like, after the first hour, you need to eat every 30 minutes. It's really hard to eat that much, but your body needs it, right? You just need to keep fueling your body. And went to bed, and the next morning, my friend and I were like, I feel great, because after the 100 miles, we're like, well, maybe we'll do 50 tomorrow. We'll just see, We woke up and we're like, oh my God, we feel great. We'll make the decision at the mile marker that we have to go left or right. And we were like, yeah, let's do this. And so there we were, 75 miles the next day, 62, rocking it. I love it.
That's incredible.
It is.
You were eating every 30 minutes. Were you eating those little goo packs or whatever?
No, I prefer real food. So here we are
Probably
again.
A good call.
Real food. I actually got yelled at by my coach. She was like, "What are you fueling with?" Because I just bonked on one of my little training Peloton rides, and she's like, "What are you eating? Tell me again what you're eating." I told her. She said, "Where are your carbohydrates? I don't see carbohydrates." And this was like 2 days before I'm supposed to leave to drive up to Klamath Falls where this ride was. And she goes, oh, we got to get some fuel into you. And so she sent me all of these little power bar recipes. So that night, and it was funny when she was asking me where my carbs were, I was digging through all my cupboards going, oh my God, I have no carbs. Like, oh, I have oatmeal. I didn't even have oatmeal, right? It was kind of hysterical. I have bananas frozen. I know I have frozen bananas. And like no carbs in my house. Lots of proteins, lots of veggies, lots of good fats, not so much just plain carbs. So anyway, I made up bags and bags of little power balls and power bars, oatmeal and what was it? Oatmeal and coconut and some molasses and, just different variations of that. And then also boiled potato, the little tiny potatoes, boiled a bunch of those up, and I weighed everything to make sure I was getting what I needed, 20 to, what was it? 20 to 30 grams of carbohydrates was what I was supposed to be eating every half hour. So I weighed things out, weighed out these little tiny potatoes and dumped a bunch of salt in them. Those were my best. They were my favorite. So I packed up, you got your little kit jersey on and you got your little rear pockets. Mine were bulging out. I'm like, how am I going to carry this stuff, right? And I'd just grab a bag and it'd be something sweet and I'd eat that in a half an hour. And on my little bike computer, it pops up, eat, hydrate, eat. It's like, oh God, just shut up. I just ate. I think I just ate. And, but it kept me going. It was so good. I felt so good the next morning. And I do a lot of hydration tablets, like noon tablets.
Yeah, those salt tablets and
Yeah,
stuff.
salt tablets, but you need the minerals. You also need sugar in your electrolyte tablets, which a lot of them don't have sugar. And they're like, oh, you don't want sugar. You don't want a lot, but our little cells, they have receptors. They're called glucose sodium gates, potassium sodium gates, and they kind of open and close to let water in and out of your cells. Sugar is one of them, right? Our body actually needs sugar. Not as much as we get these days, but yeah, our poor bodies are kind of freaking out with this new culture of having carbohydrates everywhere.
What do you make of those low carb diets or like a carnivore, keto?
Yeah, so I think there's a place for all of them. The keto diet, um, you kind of got to look where the research has been done. So the research on keto diets, I think, was done primarily on men. I think primarily, I don't know it. And it was also a very small pool. Like their N number was only 15 or something. So I think with keto diets, you have to be really careful because they can be really hard on the kidneys. They can be really hard on the liver. I think most people just need to eat less carbohydrates. They need to eat less refined carbohydrates, less bread, less cookies, less carbs. When you're getting carbs, you need good whole grain carbohydrates, right? Some rice, some quinoa, some whole grain breads, but minimum. That's not like 6 slices of bread a day. That's not necessary. I think Mediterranean diets, just kind of sensible diets, are the most important thing. I think basically when you're looking at a plate, 2/3 of it should be vegetables. And it should be every color vegetable you can get. And you try to eat different vegetables throughout the day because those colors are all giving you different nutrients, right? Really good protein, be it a plant-based protein or, animal-based protein. You want to be careful where you're getting your proteins from. Not a lot of fish because mercury is an issue, the cold water fish. Salmon's great. And then you want some grain, some sort of a carbohydrate. It can be pretty minimal. It can be a whole grain. And you want healthy fats. Like you need fats. Do you need as much fat as a keto diet has you doing? Probably not. Putting your body into ketosis is kind of hard on the body. It's not where it wants to go to metabolize energy for the body, but it can do it. So I think most of these diets are too extreme, basically. Sometimes it can be good for a kickstart, but I don't recommend them long term. Just kind of sensible. You got to look at what your body needs. I always like to bring my patients back to how we evolved. What were we doing, when we were hunting and gathering? We weren't out there trying to gather a whole bunch of oats from the grass stalks. Maybe we had some kind of piled away in our caves, but mostly we were doing roots and vegetables and nuts and things that we could find, and if we could hunt down that deer, precious stuff, and just kind of pay attention to that. And sweets are an interesting thing. Like our brain has to have sugar to function, so we are hardwired to crave sugar, to want sugar. So a little bit of sugar, our brain's like, yes, you're feeding me, right? But if you think as a hunter-gatherer, we didn't have sugar available to us. When we had sweet things was in the summertime, fruit everywhere, right? So think of a bear. They're gorging themselves on fruit. Your body is like releasing all of this insulin saying, oh, store this fuel as fat. So the wintertime, we can have something to use, right? We can go into ketosis and use that fat as necessary to get us through the winter. And then we have sugar again. There was honey, but, honey was kind of risking your life. If you climb that tree and break your leg, you're dead. Your tribe doesn't want you anymore. You're worthless. You're going to die. So, you got to kind of think, how did our bodies develop? Yeah, we crave sugar, but now we have it everywhere. And so you eat a little bit and you want more, and you eat a little bit and you want more. And then you have a good meal, and then your body's like, give me the sugar. Where's the sweet, right? So it's kind of looking at that and realizing where that came from. And sometimes that helps people kind of go, oh, okay, this is my animal self. I don't need this much. And the more you take sugar away, the less you eat, the less you crave. People are like, those first 2 weeks of stopping sugar, oh my God, it's so hard. And now I don't crave it, right? But then I took a bite and now I can't stop eating it again. It's so funny. Our little bodies try so hard to do what they're meant to do. And, our little forebears didn't have like a 7-Eleven on every corner. And when you walked into the store, it wasn't burritos to go and sandwiches to go and candy and cookies and whatever. So anyway.
Yeah, and the insane quantity of sugar in each thing. That's what's really crazy. Is it's not 5 or 6 grams. It's 50 or 80 grams of sugar in whatever you're eating.
Yeah, and in non-sweetened things, right? You're finding all this sugar hidden in things. It's like, why
you can find it in hot sauce.
I know.
Why is it in hot sauce?
Why is there sugar in hot sauce? Why is there sugar in my lunch meat? Why is there sugar in my bread? Why is there... It's kind of crazy. But the manufacturers know we're addicted to sugar. And so even though it doesn't taste sweet, the body's going to catch on to it and it's going to eat more. It's hard. It's a struggle. The struggle is real.
Especially with diet, the struggle is real because food tastes so good, and food that is bad for you tastes the best.
And you got to eat. It's one thing if you're an alcoholic and you're trying to quit drinking, or you're a smoker and you're trying, you just stop. Well, I say that, but you can stop. But food you have to eat every day, and you have to figure out how I'm going to get that food, and you need to plan and have things ready. So when you're hungry, you have something good and you're not just going for, I'm going grocery shopping, but I'm so hungry. I'm going to grab this bag of chips while I'm like, it's hard. It's really hard. Yeah.
What do you make of the kind of switching gears, but also kind of not switching gears? The aspect of mental health nowadays, and that we're constantly prescribing medications for it. Do you think that some of that is dietary? Do you think some of that is valid, that we should be going towards meds, or just treat that as a backup, that we should try to solve some other factors first?
Well, kind of all of the above, right? I mean, it's so many different things. I think medications can be, the right medications at the right time can be amazing. Frequently, medications just kind of numb you and take away all of that feeling. So you're not feeling one way or the other. It's a huge complaint from patients. A lot of times I have found, it's like neurotransmitters, right? Our body makes neurotransmitters, serotonin, dopamine, our feel-good, things. Serotonin, we have more serotonin receptors in our gut than we have in our brain, right? So that fluttery feeling, the butterflies in the stomach, yeah, that's a real thing because that's where your serotonin receptors are. And so having a healthy gut, kind of funny, right? Having a healthy gut is important for that kind of thing. Making sure, again, you have the right nutrients to make those neurotransmitters for your body. It's one of the things I discovered late in my life. Like if I had the right supplement to take to help support the production of that neurotransmitter, I felt so much better. And it was one of the B vitamins, and it just helped that conversion to the serotonin, which was so helpful for me. It was kind of amazing. And there's some really good herbs that you can do these days that are helpful for depression. But you also gotta figure out why are you depressed, right? So you need a good therapist, and there's a lot of different therapeutics, talk therapy can be helpful. I have found EMDR, this rapid eye movement therapy, to be amazing. They mostly talk about it in conjunction with, post-traumatic PTSD, post-traumatic stress disease disorder. Um, I found it super helpful for depression. It helps rewire those tapes, that like, oh, this happens and this is going to happen and then this happens. And it helps stop that and kind of rewire those neural pathways. So you can stop thinking, oh, this happens, this happens. No, this may happen, this may happen. Oh, there's lots of alternatives. So EMDR is great. Sometimes a neurofeedback can be very helpful for that kind of thing. Therapy is huge. I mean, you have to figure out, life is hard. Life is hard. And then some people get really kind of set up from the get go in situations that just make it catastrophic, and you kind of wonder how they actually have made it as long as they have. So I think that's super important. Um, Unfortunately, I think antidepressants are overprescribed, right? Like, how many times have I said, the doctor doesn't know what's wrong with you? Here's an antidepressant. Go ahead.
You're fixed.
Yeah, you're fixed. Out the door you go. Or an anxiety medication, right? I have found so many patients who have had like a folate deficiency or a B12 deficiency, and their nerves, you needed these nutrients, and then, oh my God, suddenly I'm not as anxious as I was. Right. So there's a lot of different things. I don't think it's an easy answer. I think our culture and our world is changing so quickly, and there's, you know, social media in general and what they put out and the crazy. I mean, media is all about, getting your attention and how to keep you tuned in. And so, what kind of horrific things can we keep talking to you about? How much do we hear good things, in social media or in the media, and so that's hard. Oh my God, the pandemic. Oh my
Well, and
God.
what does that do if you are constantly spiked into this state of stress every time you pick up your phone? And how many times do people do that every day, all day?
Yeah, it's a huge problem. It's a huge problem for our younger generations right now, right? Like, I don't know, I didn't have a cell phone when I was 5 years old, and I wasn't looking at it, and certainly didn't have one in school, and it's hard. It's overstimulating to the brain in the wrong way. They're not getting enough sleep. They're anxious about, what else is going on? What am I missing? It's so hard. I certainly don't have an answer for it. Part of me thinks, yeah, don't give your kid a phone until, they can deal with it and have phone, screen time. I think that's a great idea. I'm not a parent. There's a reason I'm not a parent. And I'm hats off to all those parents out there, because it was hard in my day, and I couldn't even imagine what they have going on now, with screens and, in the pandemic when all the kids were at home and not being socialized appropriately. And so many young people are really struggling still with that socialization and trying to figure out what they're supposed to do. It was funny going into the pandemic. I thought, kids, they have these little plasticity in their brains and they can adapt and change. And they didn't do so well with being isolated. I really take back everything I said at that point, because it was hard on them. It was hard on everybody. It was a tough time. I remember people are like, they're like, I had such a hard. I lived by myself, so I had no physical contact for 2, 3 years or something, whatever it was. And, it's like people didn't get it. They were going home to their husbands or wives and kids and getting hugs, and it's like, nothing. And I used to hug my patients. I hug my patients again. I'm so happy to be able to hug my patients. And, it was a tough one, that not having any, and I'm a loner, so I don't really, that was okay. I didn't mind being at home by myself, but not having physical contact with people was super hard. So, yeah, it's tough. I don't even know why I went off on that, but mental health, it's a tough one, and I just think it's getting harder, and I wish I had some good answers. Nutrition, definitely. A lot of things you can do around that. Therapy, definitely.
Exercise.
Exercise.
I mean, how many people feel like crap physically and mentally, but they don't do anything? They're just eating
Yeah.
processed food all day. They're not exercising, and then they wonder, why am
'Cause
I depressed?
it's a cycle, right? Because you don't feel good, so you eat the food,
That
and
makes
then
you not feel
that
good.
makes you not feel good, and makes you overweight and unhappy. And let me tell you, when you're really depressed, there was a time in my life where I was really depressed, and I remember going in to some doctor's office, and they're like, "Well, exercise would make you feel better." And I was just like, "Screw you. You have no idea, like, how hard it is for me just to get out of bed every day, and you're telling me to go exercise?" I was like, I couldn't even imagine. Now I live on the endorphins that my weightlifting and cycling training. I love it so much, but it's hard. It is hard, and people need that kind of constant support and encouragement. And then one day it's going to be like, oh, yeah, maybe I won't eat so much of this, or maybe I will just go out and walk. The Japanese have this thing called forest bathing, where it's you go outside and you walk in nature. Just be in nature. And even if it's going and sitting in the community forest or going and sitting on the beach, and that kind of thing can be so helpful. It just is so helpful and so calming to the psyche. And it gives us these negative electron bathing, basically, right? That just kind of helps calm everything down. So it's a thing. I sometimes wish I would think about just writing a prescription. Sure, you want a prescription? Here, go walk in the forest. I don't want you running in the forest. Just go be in the forest be with those big, huge redwood trees. We live in an amazing place.
We do. We definitely
I
do.
love our place. Anyway, so yeah.
Well, Sherry, this was a lot of fun. I really appreciate you coming on and talking with me. I had a great time.
Can you tell I love talking about this stuff? It's my passion for sure.
It comes across.
Yeah. Yeah. It's my passion. I love it. I love being able to bring the medicine to Humboldt County. Because we're kind of the only thing. Peter Stern's down in Garberville, and I think he's getting ready to retire. And we're from here to Reading we have patients up in Oregon that come down to see us. That's weird. Like, Oregon has a lot of naturopathic doctors. Why are you coming? Okay. So yeah, it's fun. It's a good thing. Thank you for having me, Nick.
Absolutely. It was my pleasure. Do you want to plug where people can find you, where they can find North Coast Naturopathic Medicine, get involved?
Yeah, so we're on Facebook, North Coast Naturopathic Medicine. Like us. And our website is also North Coast Naturopathic Medicine, or NCNatMed. That's the easier thing to do. You could call us. Our office is 707-840-0556. You can find us. Just Google us. We're like the first ones that pop up because, that's right, we're the only ones. But yeah. And we love to talk to patients and let them know if we can even help you, right? So, which we can help most people.
Okay.
Yeah.
Well, thank you, really.
Thank you. This was fun.